All right, good afternoon, everybody. We're going to begin our city-county press briefing on COVID-19. And we say this usually on Friday, but we haven't lived up to it. We're going to give most of the time to Texas A&M Corpus Christi. And I wasn't going to speak, but today's number of new cases needs a little explanation, and so I'm going to do that first, and then we're going to turn it over to Dr. Bird, who will consume the rest of the briefing today. So let's look at this first chart that shows the number of new cases. And you can see for today, we're reporting 436 new cases. And compared to the rest of the week, that seems almost double, right? It's obviously a little bit more than what we expected. And recall back to, I don't know if it was last week or the week before, but the state has taken over some of the cases in terms of contacting the patient and managing the data. And then they give us the data to put into our database, and then we report it out. And their practice the first time was they held a lot of cases, and then they gave it to us all at the last minute. And this is a phenomenon with today. It's a big data dump from the week, and maybe a little bit into last week even, of cases that have been confirmed in Nueces County that have been managed by the state. And so what we did a moment ago is we looked at the week. If you look at the week, this week here, these past 5 days, the 238 to the 436, and took the average of those 5 days, the average is 280 cases per day for this past 5 days. And then if you compare it to the week ago, over here, if you compare it to those 5 days, that 5-day average was 327. So 327 on average per day a week ago compared to 280 this week. There is a decline overall, right, week over week. That's 14% fewer cases on average per day this week than last week, or 327 new cases per day a week ago compared to 280. It's still nothing to write home about, right? It's still a high number, 280 cases. But it just puts into context, the reason for bringing it up is to help put into context that 436 number, which is primarily a significant data dump. And Annette won't be speaking today, but today we didn't test too many people in the city drive-through. We had more scheduled again than actually showed up. So had it not been for the data dump, that number probably would have been less than yesterday's. But based on the week average, it's still not anything to be proud about. Okay, this here shows a number of recovered versus active cases. We made a little bit of headway today in that recovery category, despite having that big new number of 436. So we're at 46% recovered at a little over 6,000 recovered cases, and then around 7,500 persons that still have the virus, or 54%. And our number of hospitalizations has gone down. So yesterday there were 306 in the hospital recovering. Today it's 294, a decrease of 12 persons. Of those people in the hospital, 136 today are in ICU, in intensive care, getting more specialized treatment. That's 10 persons greater than yesterday, where there was 126 people yesterday. And then the number of deaths has gone up, but not as great as the past several days. So today, 2 new deaths to report. So yesterday we had 227 total deaths since the beginning of March, April. With the 2 additional, that brings us to 229 deaths today. And then this graph is good if persons can see it. It shows our daily count as well as our 7-day average. And so you can see with the addition of that 400 and some odd new cases today, the trend line is going back up a little bit. And but Dr. Bird is going to talk to us about that in greater detail, about the trend and the curve and the decline, hopefully. So the 7-day average went up a little bit now because of that big number today. So yesterday it was 230, our 7-day running average. Today it's 241 is the daily average for the past 7 days. Okay, so that concludes the statistics. We're going to have our staff translate it quickly into Spanish, and then Dr. Bird is going to come up and do his presentation. Thank you.
En las últimas 24 horas se han reportado 436 casos confirmados por el coronavirus. 6.307 pacientes se han recuperado por completo, 294 continúan en el hospital, 136 están en la unidad de cuidados intensivos. Hoy se reportan 2 fallecimientos. A la fecha, los fallecimientos totalizan 229 personas. Gran parte de estos 436 casos son reportes que se recibieron en la última hora, pero el promedio semanal sigue bajando.
All right, looks like we're signing into WebEx here. Not sure what's happening with that. All right. Okay, my name is Dr. Chris Bird. I'm here on behalf of the COVID-19 Task Force to share with you our weekly report. The objectives of the task force are to address your concerns about COVID-19, as well as the interventions that are in place to combat the transmission of COVID-19 in the Coastal Bend area. We're also here to enable evidence-based decision-making, providing the best modeling and analysis possible for the decision makers here in the Coastal Bend area. We start off each week with this slide. An outbreak, it's a rapid rise in the occurrence of a disease. There's an outbreak around the whole world right now. It's a pandemic. There's also an outbreak in the Coastal Bend area and the greater Texas area. So the size of an outbreak can be variable, can be small or big. So we're in an outbreak that's in an outbreak that's in an outbreak around the world right now. It's not a great place to be. This graphic shows you how quickly COVID could spread. This is a transmission rate of 2, which was achieved in many counties around Texas, but here in Nueces in the Coastal Bend area, we got all the way up to a 3 before the state implemented new restrictions on June 26th. Since then, was that about 6 weeks ago? For 6 weeks, we've been trying to get this outbreak under control, and we're still working on it. It's not over. COVID-19 is transmitted through the air. It's transmitted through surface contact, and then you're touching your nose, your mouth, your eyes. Basically, it's very easy to transmit, and that's one of the things that's hard to control about COVID-19. There are several interventions that are in place. I believe people are continually being encouraged to stay at home if they can, to social distance and wear face coverings. These are actual laws where there's a penalty if you don't wear a face covering in public. Self-isolate if you're symptomatic, or if you encounter if you have a close encounter with somebody that tests positive for COVID-19, contact your healthcare professional and go from there. School closures is something that was in place, but continually, at least the media is reminding me about this when I get interviewed every once in a while, that schools might not be closed for too much longer here. And then the question becomes whether there's in-person schooling or whether it's remote, and there's a lot of different things happening across the country right now. This isn't just an issue here in the Coastal Bend. It's a national and a worldwide issue. And lastly, we went through 3 phases of Open Texas before Open Texas Phase 3 was repealed 6 weeks ago. And then we rolled back Open Texas Part 2 partially also. And we're in right now what I'm terming Open Texas 1.5 because it fits very nicely within the graphs to put numbers on these different phases right now. And so what that means is that there's additional restrictions in place that weren't in place 6 weeks ago to get the current outbreak under control. So these efforts have been successful to some degree in getting the outbreak under control. Right now, the transmission rate, which is on average, if somebody gets infected with COVID-19, how many people do they pass COVID-19 on to? Well, if you have 10 people that get COVID-19, on average, 9 additional people will get COVID-19 from them. What this looks like on an individual basis is one person is likely to infect another person after a week. After 2 weeks, that person infects another person, and you get the idea. Over the course of a month, there's about 5 people that would be infected at this transmission rate. Now, if the number of people infected in the coastal bend was really low, this transmission rate wouldn't be too bad. The problem is there's a lot of people in the coastal bend that have COVID-19 right now. And so even a transmission rate of 0.9 results in a large number of additional people getting infected. Just think about how many people there actually are here in this position right now, and then how many additional people will get infected the next week and the week after that. So we're still in the middle of a public health crisis, and it's important to not get desensitized to these crazy high numbers that we're seeing every day and every week. 400 I saw today, I almost didn't even blink when I saw it, because we've been even higher than that and on other days. And I still remember we had days where there were zeros. There was even a week where there was a lot of zeros across that week, but those days probably aren't going to return anytime soon. So this report's for the 12-county coastal bend area. This is a trauma service region, so this is kind of a hospitalization area, and the way that hospitals are managed across the state is in these series of trauma service areas. Ours is the coastal bend with these 12 counties. The colors on the map tell you how many cases of COVID there are. The brighter the red, the more cases there are. You can see Nueces right here has the most cases of COVID-19. San Patricio for a while was second, but B County is really making a run at San Patricio, and this is not a competition that you want to win. You want to be down here with 6 cases, not with 10,576. This is a good time to remind you that our data that we use to compare across all the different counties, it's 1 day older than the data that you get presented by the city and county, because it takes a little while for that data to get uploaded into the state's databases. So in order to make these comparisons, the numbers won't match exactly with what you saw Manager Zanoni just present. So last week, we had a few data issues. We're still dealing with those issues. And in the interest of complete transparency, I want to show you what I did this week to deal with the data issues that we're having. So if you look at this graph, it's the total number of cases that we've had in the coastal bend since the beginning of the pandemic. This number, 14,124 cases, is not going to change. However, you'll notice right here, we somehow went from a high number of cases and lost a couple thousand, and that's not possible with a cumulative count. What was happening was mistakenly probable cases were being added into the data set. So if you download the data from the state, this is exactly what it looks like. And if I were to process this data, it would look like we lost 2,000 new cases. We'd have negative 2,000 new cases on this day, which is impossible. So we want to do something to try to fix that. And we want to try to figure out how many of these cases over here are from people that are that were probable cases versus confirmed cases. I just want to define that a probable case is somebody that got diagnosed by a doctor as having COVID-19, and then they also had a test that was positive for COVID-19, but it wasn't the gold standard PCR test. So a confirmed case is one that has the gold standard PCR test being positive. So this is the area that we're interested in right here. This needs to be corrected. So we figured out that there was roughly about 25% of the cases every day from that period of June 26th to July 24th were probable positives and not confirmed. And so we subtracted them out of the data set. You can also see that right here, the most recent cases are exactly the same between the two methods. So this is something as time goes on, it won't matter that much anymore, but right now it still does when we're looking at things like me calculating the number of new cases per day from this cumulative data set, which is the way the state makes it available. So 14,124 total cases in the coastal bend up through yesterday. So next, active cases. we have the same sort of issue going on where we have this drop because some of these active cases were probable cases and not confirmed. So we applied a similar correction, and you can see when you get to the present day, there's a fairly good overlap between the probable positives or the probable positive active cases and the confirmed. And so there's not a big difference. It's actually a little bit more with my correction with 6,107 confirmed active cases. And again, this data is from a day ago, and so it's not going to line up exactly with what Manager Zanoni presented. So with this number, 6,000 active cases, there's 600,000 people in the coastal bend, and a report by the CDC indicates that on average, there's 10 times more people that are infected than are identified as positive through a confirmed PCR test. And so we estimate that there's about 60,000 people in the coastal bend that actually are active cases of COVID right now, which is about 1 in 10. And the way we get to 1 in 10, 60,000 out of 600,000 people in the whole coastal bend, it's 1/10. Next, with the recoveries, just in the interest of full disclosure, since we're going through how we massage the data, if you will, way back in May, there was a day where we went down in the number of total people recovered. Again, this is a cumulative thing that could never come down in reality. So what we do is we do this backwards algorithm that takes, if the day before has more cumulative cases than the day after, we make the day before have the same number of cumulative cases. And you can't even see it, but there's a blue dot underneath there that we corrected. Everything else, you can't see the blue dots because they're exactly lining up with the red dots, which are the corrected data. So there you go, full disclosure on what's happening with this data. There's 7,811 total estimated recoveries in the coastal bend right now. And we normally present this data like this in this graph. So this is all the corrected data now, 14,000, 6,000, 7,800. And there was a wave back here, but the wave we're in right now is so big you can't even tell anymore that there was a wave way back in April and March. Then we have our local outbreaks, which you can still kind of make out as a little blip on the increase there. And then more recently, this huge Texas-wide outbreak. Look at where we are right now with the active cases. We're not way down here. We're nowhere near recovered. Somebody said this week that people are asking them, this is over now, right? And no, this is not over by any stretch of the imagination. We're right in the middle of it. It's not close to over. We're right in our peak of active cases. And our transmission rate is 0.9. If that ticks up just a little bit, then we're back into accumulating more cases than the week before. And we estimate there's about 1 in 10 people actively infected right now from these active cases. So moving forward, this graphic hasn't been updated since last week because we didn't receive any new data, but the last we checked and were able to look, there were 25% of the tests that are coming back are positive. These are from the mobile testing stations. The reason why we use this data is because, as far as I know, it's the only data that we have locally where we know definitively how many people tested negative and how many people tested positive. For all the other ones, we know how many people tested positive, but we don't know how many people tested negative, so it artificially inflates the percent positive. This one, the percent positives aren't artificially inflated. This is the percent positive rate that's coming back from the mobile testing stations. And next week, hopefully, we'll have an updated version of this for you. But you notice there was a little uptick in the last bit of time where we got new data on this. In terms of our rankings for cases in the state, right now we're going down a little bit in the rankings, and that's what we want. We want to be in dead last in these rankings for numbers of new cases per day per 100,000 people. While our number of cases are going down somewhat, our ranking is still pretty high within the state. And so we've got a long ways to go. And what this means is that COVID is more prevalent here than it is in most other places in the state. If you look at some of the other places here besides the coastal bend, we've got Lower Rio Grande Valley, Laredo, Victoria. Do those places sound familiar, right? They're all right around here. And so this part of Texas, not just the coastal bend, but southern Texas, is bearing more of the brunt of this outbreak than other parts of Texas. So that's something to keep in mind. We can zoom out a little bit and look all over Texas. And let's compare South Texas, which is called Public Health Region 11. That's what the number means there. These are the different public health regions that the state's broken up into. And you'll see South Texas right here, far and away, has more new cases per day per capita than any other public health region in the state. And it's not even close. It's more than double that of Houston. And if you look at San Antonio, I think everybody, well, maybe not everybody, because you don't see the messages that I get, but back early on when we were comparing ourselves to San Antonio, a lot of messages came back saying, oh, that's not a fair comparison comparing us to San Antonio. That's such a huge metro area compared to the Coastal Bend or South Texas. And again, we're using San Antonio for Public Health Region 8, but now look at it. It's the lowest in the whole state compared to us here in South Texas. So that's why we do these sorts of comparisons to see where we rank, and hopefully in the future we'll get back to being the ones that are the bottom on this list. When we look, zoom in on the South Texas area, we want to see, okay, this is the hardest hit in terms of COVID right now in all of Texas. Let's zoom in on some of these different counties that have large populations. And you see Brownsville is far and away the driver of Public Health Region 11 in South Texas, having a lot of new cases per day. But I want to bring your attention to this curve right here, this teal curve that matches us, Nueces. And what you can see is that it's decreasing, but the rate at which it's decreasing is slowing down. And so what this indicates is that we're leveling off at this number of new cases per day now. And so if we don't do things differently, then they could level off or start increasing. And we'll get to that farther into the presentation. Again, new cases per day, zoomed in on the Coastal Bend. These are all the counties that aren't Nueces County. And the reason why we show this is because Nueces has so many more cases that it's hard to see these other counties. So we zoom in on these without Nueces, and you'll see B County has the most new cases per day. These are not per capita, they're just straight up numbers. San Patricio is on the downturn lately. Clayburgh is on the upturn. And I encourage you, if I pronounce any of these counties wrong, I know I've been pronouncing Clayburgh wrong for the past several months, please let us know, and I'll make sure I correct that. Jim Wells trending downwards, Live Oak trending upwards. So you can see that we have a mixed bag of trends going on here in the Coastal Bend area. And so the outbreak's not over, and if you're not in Nueces, it's not like you're isolated from COVID-19. COVID-19 is definitely there in these surrounding counties in the Coastal Bend. Okay, moving on to hospitalizations, going from infections to hospitalizations, because this is the way the disease progresses. Some people have really negative consequences of COVID-19. One of the doctors on the front line that's on the task force shared a story this week where somebody came in and they were getting treated, and they said, I didn't know it was going to be like this. And I think that that's important for all of us to realize, is that COVID-19 is not this trivial thing that that you may be able to just not even know you have it. Well, some people that is the case, but other people, this is the worst flu or cold, if you will, whatever you want to describe it as, that they've ever had in their lives, even the ones that don't go to the hospital. There are plenty of people that have really negative outcomes, and people could be healthy or not healthy before having these negative outcomes. There may be a genetic component to it. And so with the hospitalizations, we're still pretty high in terms of the state. We're number 4 ranked, but if you say there's really not that big of a difference between us and Laredo, and then Lower Rio Grande Valley and Victoria are essentially tied, we're just as good as tied for second place, pretty much. And we want to be in last place on this. So we're nowhere near where we need to be. Hospitals are definitely over capacity when it comes to ICU. Let's see, we can look at that here. So these are the med-surg beds. Med-surg beds aren't ICU, they're general beds if you're not in intensive care. You can see that the number of people in COVID has increased, and it's starting to decline now. And it's about 25%, 33%, I'm sorry, of the total number of people in the med-surg parts of the hospital right now. And you can see that everything's kind of just been pushed up. So this is an additional strain on the hospital system here in the Coastal Bend area. When we look at the ICU, this is where the real strain is. You look at over here, on average, you're looking at just under about 150 people in the ICU in the Coastal Bend on any given day back in May, when we had a day or two where there were 0 cases of COVID. And then what you see here, the red are the COVID confirmed cases, not just probable, but confirmed. And you can see that gets all the way up to where we were at for just normal, everyday people in the Coastal Bend area needing intensive care. So those people are being displaced, and not just up, but sometimes there's just less people that would, people that would normally get an intensive care treatment, now they're not, because of how many people with COVID are in the hospitals. So yes, we're going downwards, and that's a good sign, but no, this isn't over, and we're not out of the woods here. We're right in the middle of it. We're right near the top. If things change even a little bit, we could be going back up again. And we're already really the limit of what our ICUs can handle. What do we project going out into the future? If we can hold where we were at for the past few weeks with the transmission rate being around 0.9, this is what we can expect for the future. The points are actual data points of the number of people reported to be in the hospital on that day. The ribbon in the line is our model that's predicting the number of people that would be in the hospital on any given day, and some uncertainty in that. This is an epidemiological simulation model, so we don't plug in really hospitalization data per se. We put in the average amount of time that somebody spends in a med-surg bed, or how much time they spend in an ICU bed, and we simulate the community and the pandemic running through the community, and this is the output from that. It's also, the model will project a number of different things like fatalities and number of infections and things like that. So right now the model is really dialed in well, and if the transmission rate stays like this is pretty much, we feel pretty confident what's going to happen. Now what you'll notice is that it's a very slow downward trend, and that's only if we can hold this level of transmission and not have it increase again through us, wearing out, for lack of a better word. In terms of fatalities, so we're progressing. If you have a really bad hospital stay, some people die from COVID-19. It's not a majority of people, it's a minority of people, but nonetheless, it's a large number of people that have died just here in the Coastal Bend this past week. We're talking about dozens and dozens of people have died. And across the country, well over 100,000 people. They're saying that maybe by December it'll be 300,000 people that die in the United States by December. So there's a lot of people that are dying from COVID-19. And just to give you an idea of how good these model predictions are, back in February, the model indicated that there would be maybe 200,000 to 300,000 people in the United States that would die. And that was before we knew all these different things about the pandemic. That was a Harvard model, and it turns out it was pretty darn accurate, given the amount of uncertainty that there was there then. Anyway, we're ranked third right now in the Coastal Bend in terms of fatalities. Again, we want to be last, not third. There's a lot of fatalities that are happening. I don't know if you noticed yesterday, 10 people. And there's just, this past week has really been our peak in terms of fatalities. And hopefully from here forward, if we can hold this transmission rate down, the fatalities will be declining. I explained what's going on here last week very quickly. If you want to go through that detailed explanation of why we have 2 graphs for fatalities, look up the video from last week. For this week, I'll just go over very quickly. There was an old way of reporting the data, which was the way that you still get the new number of fatalities when Manager Zanoni tells you today that date gets logged. It's this brown line here, and the number of people that were reported on that day get recorded. And we're continuing to track that for the Coastal Bend up to a certain point, and then Nueces County past that point. And then the state decided to change the way that people were being logged. And I do like the idea that the date that goes along with this is the day that people died rather than the day it got reported. And that's why you see a shift in the dates here. Because what happens is when people die, their death certificate doesn't necessarily get filled out the moment that they die. It could be a day or two later. especially when we're having a surge on the hospitals the way we are right now. And so what's happening here is that overall there tends to be more cases on any given day because people die sooner than they get reported to you through the traditional reporting mechanism, but then it takes longer to tally all these. So the state is tallying how many fatalities that there are. And in the old way, there were 217, and right now with the new way, we're at 206. And this number is going to increase. So here in this area, these numbers are going to keep increasing as the state continues to go through the death certificates and tally them up. You can expect to see a roughly parallel track of these two lines. That's how you can tell where it starts to get affected by not all the data's in, right around where that box is. Okay, in terms of our model, same model that I showed earlier, assuming a transmission rate of 0.9, we're predicted to be at the peak right around now. Realize the date here, August 2nd, and we're over here a couple more days. Where's all the other data points? Well, it takes a while for us to get those data points, right? 206, and you can see it kind of bending over there. So we hid those, and we didn't show those data points right now because they would just go right back down to 0, essentially, until they get logged. What you can see is that the data is roughly fitting the model well. We had one day back here with a lot of fatalities in the coastal bend area, well over 15. But in terms of where we are now on today, we're predicting that we're going to start to go down as long as we don't increase the transmission rate. Okay, that brings us to the last part of the presentation where we talk about cell phone data. And the cell phone data tells us what's going to happen in the future. Are things going to keep going the way they have, or are they going to get better, or are they going to get worse? Now, the reason why this is because there's about 5 days between when you get infected and when you actually show symptoms of COVID-19. It might be a few more days until you get tested, and it might be a few more days, depending on how many different tests are being done in the county at the time to get those results. So you're looking at up to 2 weeks, sometimes even more, sometimes a little less of time between when you get infected and when it shows up as a statistic. So right now, what's happening today is going to affect our numbers 2 weeks from right now. And that's why we look at the cell phone data, because it's lagged a little bit. It's a couple days old, but it's not that old, and it really can give us a window into the future. I know you're concerned about your privacy, and when you downloaded that app and it asks you, do you want it to have access to your GPS, that's when you gave the rights to your privacy away. And you gave the rights over to Mark Zuckerberg or somebody else who's then selling that information about all the different places you go to sell you products. So this data can be purchased, and then it can be analyzed. We don't have names attached to the data, but we would know devices and basically which counties they reside in, which zip codes they reside in, so we can do some interesting things with that data. First thing we look at is the distance traveled and the proportion of people leaving home. These graphs are all showed the same way, where we do it as a proportion of normal, normal being defined as 100, which is the activity that was seen in February and early March in these categories, and we're comparing that to now. So if we get back up to 100, that's the same type of activity that would have been happening back before the pandemic started. So you can see in Open Texas Phase 3, we got up to even higher than 100% of normal. And that can happen because different things are happening at different times of the year. Maybe less people were traveling in February than now, or in the middle of June. Since this point in time, there's been a steady decline with the rollback of Open Texas Phase 3 to 2. That 2 should be slid over a little bit. And then in what I'm calling 1.5, one thing that you'll realize is there was a price to pay for Open Texas Phase 3. You look at how wide that is, and here's the price right here. This is the widest band that we've been under restrictions for. And that price to have Texas open at Phase 3 levels is all this extra time, 6 weeks now and counting, of additional restrictions to try to get this under control. You can see here, this is maybe the good news slide where it's still going down a little bit. It's going to be about the only one. Next, we look at the potential encounters. What this is two cell phones coming near each other, and if they're near each other for long enough and close enough, then it might get recorded as an encounter. And you can see that now, since the restrictions got put into place, there was a dramatic decline in the number of encounters. but there's been some backsliding that's occurring, especially on the weekend, with the one exception of the hurricane where pretty much everybody was avoiding encounters. But I'll point out that this point is not as low as the lowest point that we hit during the stay-at-home period. So there was more encounters happening in the coastal bend when a hurricane was hitting here than when we were in the middle of the stay-at-home order. But with that one exception, on the weekends, the numbers are generally going up. And this is cause for a serious amount of concern. It's getting close to 100%. This is last Saturday. Close to 100% of normal activity for encounters on the weekend, and that's a direction that we don't want to go in. With these numbers going up like that and during the week, we expect that we'll see the transmission rate start to increase from 0.9 and it'll start to go higher. And we'll start to see the effects of that maybe a week, 2 weeks into the future from now. Next, with essential and non-essential gatherings, I know there's a lot of lines here. The blue are essential. The ones that aren't blue, not essential. We can see an uptick in the movie theaters. And I wasn't aware, but I guess some movie theaters started to open for business in this past week, and we can see it in the cell phone data. So, I mean, if you were wondering, does this cell phone data really work? There's the hurricane. It works. Movies opened this past week. Movie theater traffic went up. It works. There's a reason why Mark Zuckerberg is, what, $100 billion or something now. His company has, I think that was in the news today. Bars up, meaning granted there was a hurricane in the past week, and you might be wondering, well, I thought bars weren't allowed to be open. Well, there's a provision that if you do 51% of your business through food, then you're not a bar. And so that's the way there's still traffic happening at bars. There's also potentially non-compliance that could lead to bar foot traffic. Beyond that, malls, restaurants ticking upwards, and not just from the hurricane week, but also from the week before that. And so this is going along with the encounters. It's not the direction we want to go in. So this is additional data that's indicating that the transmission rate is going to increase coming up in the next couple weeks. When we look at recreational foot traffic, I know the beaches has been a really hot issue lately, and it looks like the amount of foot traffic in the beaches in the last 2 weeks has been low. Now, this week was Hurricane Hana, which obviously you'd expect there to not be too much traffic at the beaches, but and this point, unlike the other one, this is not just for the day of Hurricane Hana, it's an average. But if you average that week of the hurricane, and go back over here, it's about Open Texas Phase 1. So a week with a hurricane had more foot traffic at the beach than where we were before Open Texas Phase 1 during the stay-at-home period. So that gives you an idea of, well, how come we're not able to get this under control very quickly? Well, this is why. These metrics show that people are aggregating. And you might say, well, the beach is outside, you're not going to get COVID at the beach. And I've been saying this for weeks. It's my belief that a lot of people love to come to the coastal bend from outside the coastal bend because of our great beaches. And when they do that, they need to stay somewhere. So they might stay in a hotel, and they need to eat somewhere. So they might go out to restaurants. And that would lead to higher foot traffic at restaurants, higher foot traffic at Stripes, and different places around the coastal bend. Normally, this is the way our tourism economy works. But right now, we're trying to just get this epidemic under control. And so that may be some of the reasons why there's a beach order for vehicles not to be on the beach right now. Here's something that's intriguing where the museums are ticking upwards. I don't know why that is right now, but we'll look into that. If that trend continues, we'll have an explanation next week. Okay, the visitors coming to the coastal bend and the beaches, right? So I think that this vehicle beach restriction leads to less people coming to the coastal bend. And we'll see since the beginning of June up through present, there's been a steep decline in the average number of visits to restaurants in the coastal bend area. So these are visits to restaurants from people outside of the coastal bend. This map shows you how prevalent COVID is with the different colors of red, and the lines show you where they came from to the coastal bend to eat in our restaurants. And what you can see is in the beach restriction was put into place, well, first on 4th of July weekend, which is here, and you saw a little dip down there, and then it came back into effect on this week in the middle of the week, and the first full week after we saw a 25% decline in foot traffic to restaurants in the Coastal Bend from people outside the Coastal Bend. And this week, maybe with all the publicity, it went even lower. And so it would seem that at least there's a correlation here between something like a vehicle restriction on the beach and the number of people, or not the number of people, but the number of visits to restaurants from people outside the Coastal Bend. Last thing with the number of visits, what this means is if you go to breakfast, lunch, and dinner and you're from outside the Coastal Bend, that's 3, and you're being tracked, right? So that's how these numbers get logged. There's a reverse flow too. We're one of the hardest hit places in the country right now from COVID-19, and we go from the Coastal Bend to other places. Amazingly, it's all over the country. I was shocked. It's people going to Maine, people going to the farther reaches of Washington State. I don't know if Hawaii and Alaska would make it onto here too if we had them, but this is a heat map that shows you about how many visits are occurring from people in the Coastal Bend to other places around the country. And as you get redder, there's more visits, right? So you kind of have a bullseye here, then you have San Antonio with a second bullseye, showing that connection again that I've talked about in the past between us here in the Coastal Bend and San Antonio. You know, love the Riverwalk, but right now probably not, you know, the best activity to do. And then farther out, we have connection to New Mexico and Arizona and all these other places around the country. So this is people coming from here, going elsewhere, and some of these people are undoubtedly bringing COVID with them, as well as people coming into the Coastal Bend bringing COVID with them. So it shows how connected we are across the country, and that's why really this is a countrywide effort, not just a Coastal Bend effort, not just a Texas effort to control this pandemic. Next, with the cell phone data, we're really going into it this week. The schools are a hot topic, right? Should we open the schools? Shouldn't we open the schools? We're going to start watching the foot traffic to schools and see what happens between the school foot traffic and the transmission rates that we're seeing in the Coastal Bend area. Right now, K through 12 junior colleges and universities, they're all pretty low in terms of the amount of foot traffic that's going on there. And since the rolling back of Open Texas Phase 3, there's been a decline, but starting to see an increase again here as the school year gets started. And then the outlier here is professional and technical schools. Just think about these schools where you go to learn a skill that's immediately applicable. That's what these represent, and there's been a fair increase, only a slight decline in the foot traffic to these schools, so they seem to be open and operating, although not at 100%, well below even 50% of their normal operating capacity. Okay, so what does this mean in terms of face-to-face schooling? A lot of people want to know, hey, what do you think? Should schools open or not? And my first answer is I'm not an elected official. I have no say in whether schools open or not, so that's not up to me. But what we can do in the task force is show you statistics that you can use to understand and make decisions and help other people make decisions. So today, New York City and New York State indicated that they were going to have full face-to-face classes, or at least it was possible for them to have that today. And somebody on the task force said that, hey, we should talk about that during the presentation, so we're doing it. We're comparing Nueces to New York City in terms of COVID-19 statistics. And the way this works is what we did was we saw what are our statistics as a percentage of New York City's. So in terms of new cases per capita, or per 100,000, we have over 500% of New York City's new cases per capita. So that might be one of the reasons why New York City could think about having face-to-face classes, and maybe here in the Coastal Bend area, that should give you pause. Second, percent positives. We're at 2,500% of New York City's percent positives over the last data point we have from those mobile testing stations compared to the latest data from New York City. In terms of the number of people hospitalized per 100,000, we're at 3,500% of New York City's numbers. And then in fatalities per 100,000, and we had to backtrack because of these issues that we're having with the way that our fatalities are being reported. So we went back to the week of 720 to 726 because we think that's the last week where we have good numbers where they're probably not going to increase anymore because all the death certificates have been processed, and we're right around at 500% of New York City's deaths per capita due to COVID-19. So when you're thinking, well, New York maybe is going to have face-to-face classes, or at least they're really seriously talking about it there. These are statistics that maybe you should think about and consider and see why is it in New York City that they're able to talk about that, and in New York State. And here, we should have more caution when making decisions like this. Okay, so in summary, there's a Texas-wide outbreak and it's not over. I know it's easy to fall into this lull and get numb to the dozens of people that are dying every week and the hundreds of new cases per day. I mean, it's thousands of new cases, essentially per week, or at least it's close to 1,000, if not well over that. So this isn't over, and we're still right at the top. We're just barely coming down, all right? COVID-19 cases, they're declining slowly, and right now, potentially about 1 in every 10 people in the Coastal Bend is actively infected or would be considered an active, have an active case if they were to get PCR tested. COVID-19 ICU usage and fatalities seem to be at their peak or declining. The ICU is definitely declining. The fatalities are right around their peak. I think they'll be declining. The model shows they'll be declining in the future, but slowly, not rapidly. The transmission rate is holding right around 0.9. And here's the red flag, is the cell phone data is starting to indicate that we're backsliding and that the transmission rate may start to go up again. And we won't see the effects of this for a couple weeks, but if we don't correct this very quickly, then we can expect to start to see an increase again. And with an increase could potentially come more restrictions, which I know none of us want. So we need to continue our efforts to reduce transmission. It's not time to relax. It's not time to have a party right now. Everybody needs to help contain the outbreak. This is from managers. This slide is for managers and people that are in charge of organizations and institutions. The task force recommends you do as much as possible to stop the transmission of COVID-19. COVID's bad for business. We all know this. If your business is ignoring COVID restrictions, then you're promoting COVID, which is bad for business. You don't want to do that. So no shirt, no shoes, no mask, no service should be the way that you operate your business right now. And it's not new that we've had to wear masks. I think that everybody's kind of getting the idea now that it's in your best interest health-wise to wear a mask because it decreases your probability of getting COVID. And if you don't close the loopholes in your social distancing policies, COVID's going to find them. There was a very public story today where a student took a picture of a hallway in their school and it looked something like this, although this isn't that picture. This is a huge loophole. So if people want to know what's going to happen to us when we open schools, when we eventually do go face-to-face. If it looks like this, the transmission rate's going to go up. If it looks like that, obviously it's not. And this is maybe, transmission rate's going to go up with that. Those kids aren't wearing masks. So you need to think about this and think about closing these loopholes and not letting things like this happen locally. We'll keep those things happening in Georgia rather than here in Texas. We'll learn from their mistakes. So how do we slow it down as an individual? Wear your face covering, social distance, self-isolate. If you're symptomatic or if you're exposed to somebody that tests positive, then contact your healthcare professional, and decide where to go from there. Stay at home if you can, wash your hands, sanitize, doorknobs, things like that. The virus can live for quite a while on metal surfaces, longer than cardboard and most other surfaces, so you want to clean those. Avoid social gatherings. Curbside and takeout is definitely safer than going inside of a building right now where COVID could be floating in the air and be self-contained. Support testing and contact tracing, and that will help to keep the transmission rate low. And we show this, we've been showing this for about a month now, but this was an experiment that somebody did where they sneezed, sang, talked, or coughed over a Petri dish with and without a mask. With a mask, there's no colonies growing on here. Without a mask, there's colonies growing on every one of these plates. And while COVID is not a bacterium, it's a virus, it's transmitted in the same droplets that transmitted the bacteria to these plates, showing how easy it is to spread COVID-19. And that a mask is really effective as long as you put it over your nose and your mouth. So if you only have it over your mouth, Well, that's not going to help so much. It's certainly not going to protect anybody else around you, and it's not going to protect you as much if you're breathing through your nose. So covering your nose and your mouth is the way to really get the full effects of that mask. And if two people are near each other and they're wearing a mask, you get more of the effect, right? So, if you're only one person wearing a mask, you only get some of that effect. And even then, a mask doesn't make you a superhero or a super person. You can still get COVID-19, you're just less likely to get it. I think that's something that's important to recognize. With that, I'd like to acknowledge the task force for the hard work that they do every week, and thank all of you for tuning in these Fridays to get our latest reports, and I think we'll go to translation.
Continuamos tratando de contener este brote quedándonos en casa usando el cubrebocas y distanciamiento social. En los 12 condados de la costa hay 14.124 casos positivos confirmados. En el estado de Texas, nuestro promedio per cápita ha bajado un poco. Estamos en el cuarto puesto en nuevos casos y en hospitalizaciones per cápita. Tercero en fallecimientos per cápita y la meta es ser los últimos. Hay aproximadamente 6.107 casos activos y 600.000 habitantes en los condados de la costa, lo que nos dice que 1 de cada 10 personas es positiva. Por intermedio de la tecnología, los GPS de los celulares, sabemos dónde se hallan los habitantes del condado. Los datos no tienen nombre, solo cantidades. Si le preocupa su privacidad, los celulares tienen la opción de apagar el GPS. Usando esa información, sabemos que los habitantes están saliendo y reuniéndose con más frecuencia que antes, a pesar de que tenemos menos visitantes de fuera del área. Pudimos recolectar información de cuántas visitas realizaron los habitantes de la costa a diferentes puntos de los Estados Unidos y hay más de 100.000 puntos visitados en el mapa. La decisión de abrir los colegios para clases presenciales aún se está debatiendo porque el brote no se ha controlado.
And now we'll take some questions from Facebook Live. Invariably, we'll need probably Annette and Peter to also help answer them.
First, I'd like to thank members of the task force that field questions on Facebook. They did an awesome job today. Philippe Tussaud, Brian Gillis, and Jason Lewis. And the city also did a great job today of answering a lot of these questions, so I don't have very many for you. That's
Okay.
kind of why I wanted to bring that up.
Perfect.
So, Dr. Bird, some of the questions that came through, this one kind of wanted to know how dangerous is kind of the restaurants that are being converted to restaurants from bars, and then other restaurants that may be not enforcing the 50% capacity rule. How dangerous would that be to the city and the population and the region here today?
Well, a lot of people think that Open Texas Phase 3, the key part of it that sent us into this rise was the opening of bars to 50% and the activity that was happening at bars. So this activity inside of restaurants and bars, the reason why it's so critical to the spread of COVID-19 is that you generally can't wear a mask while you're eating and drinking. So you're unmasked and you're exposed. Second, if you're inside in a dining room area, then you're in an enclosed area where COVID-19 can be airborne. If their air conditioning system is, say, like a mini split where it's just blowing air around inside the restaurant, that's just recirculating air that's there, not bringing in new air. So these sorts of things start to contribute to an environment where there's a high transmission rate. You combine that with not following the rules and having more people in there than you should. Even at the present regulations, it's questionable whether it really stops transmission. I mean, it definitely is not going to stop it, and transmission is still possible in those environments. But it's believed that that was a key element to the launch that caused this current wave that we're in right now. So it's really important. And when those got dialed back, the transmission rate changed, and we started to get this under control. So we can see a direct outcome of our actions. Now, the thing is that if we close, say, on June 26th, we rolled, or maybe it was the week after, we rolled back restaurant occupancy and closed bars. But it took weeks to see the results of that. And that's one of the things that's hard about this, that it takes a long time to see the results. And that's where, people, it's important for them to understand the dynamics of how the virus works and understand these actions that are taking place. They make sense, and it's going to take a while to see their effects. But now it's, very clear, from rolling back open Texas phase 3 and then even parts of phase 2, that got us to exactly where we are now from the peak. Otherwise, we'd still be going up. And so everything that's been rolled back right now is critical to staying where we're at in terms of the trajectory. And then changes to that, like opening schools face-to-face and having more gatherings and things like that, will lead to a higher transmission rate, whether it's at a bar or restaurant or whether it's anywhere else in the coastal Bend area. So these are critically important things that are having a huge effect on the way the virus spreads.
So, Dr. Burden, you're leading into another hot topic that's been, on Facebook, especially here recently with things that are coming up. What do we see with school openings, with the ISDs and universities and other professional schools opening up?
Well, like I said, if we have an increase in encounters, we expect the transmission rate to respond. We don't know yet how high it'll go. It's going to depend on whether hallways are packed, whether hallways are properly distanced and everybody's wearing masks. It's going to depend on all those sorts of things where it can only be regulated so much from on high, and it comes down to personal decisions by teachers and administrators within schools and the parents sending their kids to those schools. And one thing I'll say to the parents out there is that what I've noticed in working here on the task force with people from the city and county is they're incredibly sensitive to criticism from the community, and the squeaky wheel gets the grease. And so if you're not happy with something that you're seeing, it's not going to help to stay quiet about it or to talk to other people. Contact your school district, contact people that really have enough, have a say over this decision. Contact your elected officials because they're listening. And I'm not a public servant. I'm a university professor, and I was actually kind of surprised at how sensitive and how responsive they are to those sorts of things. So that's my advice to people out there. But you can't increase encounters between people without increasing the transmission rate unless we do something even more to try to dial back. But it's already, we're wearing masks. The more people that wear masks, the more effective it'll be. It's important to wash your hands. Doing all those things will help to minimize. Where we're at right now, it's not like we have a lot of room to be able to let the transmission rate increase from where we're at now.
Thank you for that answer. And this one may be a question to the city. What can we do about the neighbors who are having parties?
I didn't touch the podium. So.
Let's see, neighbors that are having parties. Yeah, I'm looking at a net, but so the governor's order is group sizes at no greater than 10. But is that on personal property as well, Annette, do you think? But I guess what you can, yeah, the judge's order was it for? Yeah, if somebody had, we can't enforce, can we enforce that? What's that? What did you say?
She said for even family members, it's still less than 10.
Oh yeah, okay. So that the governor's order would regulate that then? It's enforceable? The answer is if it's enforceable, the police department can help break it up.
I think people would report it.
Yeah.
Call in and they report somebody was having a party next door.
Okay. So the answer is if you report it to the police department, and then we'll go over there and break it up.
Okay.
Yep.
And this one may be both Annette and Chris's. Is Nueces conducting the amount of contact tracing we need? Is there more that can be done?
I'll let you handle that, Annette.
So, yes.
Is Nueces County conducting the amount of contact tracing we need, and is there more that can be done?
Okay, so for contact tracing currently, as of yesterday afternoon, around 5 p.m., we were completely caught up. And so at 231 cases yesterday, we have 20 contact tracers that we've assigned currently, and we assign them between 10 and 15 cases each. Now today we have 436, so now we have to assign them 20 plus each. And so it takes more time, they have to stay longer, they have to make more phone calls, so we can actually increase the number of contact tracers as well because we have phone bank individuals. And so currently we have what we need, but if these numbers continue to spike like we've seen in the past, then we have to call in for additional resources.
And how much time does a patient spend on ICU on average?
I actually know the answer to that. HCA told me that it's 6 days for people in med-surg on average and 8 days for people in the ICU in southern Texas on average. Some people stay much longer, and I'm sure Nat could attest to that.
All right. And that's all the Facebook questions. Thank you, guys.
Thank you.
Question the viewer was asking. Are stomach issues, are people starting to see stomach issues associated with coronavirus? Is that something you guys are looking at?
Yes, yes. So, and it's been at least a month where we've noticed that people start having gastrointestinal concerns, like they have stomach cramps, you know. Even early on, to be honest with you, we saw people that were complaining of left-sided pains, but there were fewer and far between. And so now we're seeing more of it. We're seeing a lot more of diarrhea. And so there are differences. And so we're also hearing that there's different strains of COVID-19, 6 or 7 different strains, which makes sense because early in March, the symptoms were the shortness of breath, the fever, the cough, the dry cough. And we were actually able to, at the hospital level, they were actually do some things with convalescent plasma, the remdesivir, the hydroxychloroquine, and the patient seemed to recover very quickly with these types of medications. And then in the end of June and early July, that didn't seem to be the case. And so now that we're hearing that there's different strains of COVID-19, that makes sense to us. That makes sense because if you have a different strain that you're not able to treat with the same medications, things are changing. And then we all heard about the loss of taste and smell, so that's a neurological. So there are things that are changing with the virus, and that's why it's so concerning to us. Every time you think that maybe you've kind of figured it out, it changes completely. Thank you.
Okay, that concludes our briefing for today. So just going forward, the process or the amount of briefings we're going to have will change starting next week, and that's because the City Council has 4 days next week of budget work sessions or community meetings, and they overlap with the schedule for these briefings. So for the next 2 to 3 weeks, and we'll give you an update along the way, we're going to have a briefing on Tuesday next week. So none Monday, but one on Tuesday, and then the second one on Friday. And the Friday one will primarily be an update from the university, similar to today. So next week, just 2 of these televised Facebook and so on briefings, Tuesday, Friday. The following week, Dr. Bird begins class, right? And that's going to be on Friday. So we're going to move the Friday briefing to Thursday. So the week of the 20th, August 20th, I don't know exactly what date that is, but August 20th or day, there'll be a briefing on Tuesday, Thursday, and that'll be the routine going forward, Tuesday, Thursday. So all the Friday Corpus Christi A&M presentations are now going to be on Thursday, okay? So 2 briefings, so we'll see you here on Tuesday. We'll continue over the weekend to update our website. Both the city and the county's webpage will be updated with statistics, as it will be on Monday as well. And the city's always here, so if you have questions or concerns, email us, Facebook us, or call us, and we'll help you over the weekend. Okay, so we'll see everybody back here on Tuesday. Be safe over the weekend and the Monday, and we'll see you on Tuesday. Thank you.